Friends, this message was created by an Indian on a Korean mobile smuggled by Pakistani and came to India. So now you see, friends, this example, simple example, how things are happening across the world. This situation is demanding us to understand what is public sphere, and what is public health. These are the very important aspects. Unfortunately, our curriculum is not able to connect with the public. We talk about health education. Health education in a medical language we try to teach. Health education in a neutral way we teach. But friends, there is a politics everywhere. Politics in education, politics in society, politics in health. We need to understand the political economy,
it's
which
11
governs,
o'clock.
which regulates the entire social processes. That is very important. If you don't conceptualize how the political economy functions, how it regulates the system, we fail in understanding so many important issues. Friends, when you talk about public health, I just would like to introduce some important ideas about public health so that we can build on this. We can develop discussion on this. And I request our friends to show the next slide. World Health Organization is expanding the idea of public health. I quote, public health itself is a state of complete physical, mental, social well-being, and is not merely the absence of disease or infirmity. In 1984, again, World Health Organization redefines the extent to which an individual or group is able to realize aspirations, satisfy needs, and to change or cope with the environment. Please see the shift, how the World Health Organization is expanding the idea of health. Next. Health, we all know it is a very important aspect. It's a foundational idea, which is very, very important for our existence. So many studies have revealed that there are so many factors which influence health and well-being of people. This is social and economic factors, 40%, health behaviors, 30%, clinical care, 10%, physical environment, 10%, and gene and biology specific is 10%. So education comes under social and economic factors. Next slides. WHO talks about a large number of deaths are premature deaths in the world. A substantial portion of deaths is avoided. Public health is related to preventing premature preventable deaths. How? Who should do it? How should we do it? These are the important questions before us. We are also partners in building society, in building our nation. So these are the important concerns, not just for medical practitioners and nurses and doctors and health practitioners, but also equally all of us should think about these important questions. Next. Public health, it doesn't talk about individual, it talks about collective. When we talk about a group, the community we talk about, community health, mental health, some of these social health, these are the different synonyms which are included in the idea of public health. Public health is a very umbrella term, it is a very broader term. The idea is how to promote health, how to preserve health. The two cardinal ideas of public health. Next. Next, public health is also conceptualized as analyzing the health of a population and the threats it faces is the basis for public health. Please, friends, you try to see where our role is there, where we can chip in, where we can, think about it seriously as teacher educator. Public health as a science of protecting the safety and improving the health of communities through education, policy making, research for disease and injury prevention. Friends, in this context, I want to share with you, that in my university, with my PhD students, we started a course on public policy education, which you all know. As part of public policy education, students of my university conducted a series of seminars, and some seminars they devoted exclusively for public health. And this is very simple, at a simple level, I started this kind of intervention. And some of these students who have passed, graduated from a university, they're in some other universities and conducting similar kind of workshops and webinars. I'm very happy to know about their concern about public health now. Next, sir. A famous health philosopher says, public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for next sanitation of the environment. Here we just recall the contributions of Mahatma Gandhi. Mahatma Gandhi, when he said, "My life is my message," his concern for communities and people and health. Please recall Gandhian ideas here. The control of communicable infections, how public health is concerned about it. The education of the individual in a personal hygiene. The organization of medical and nursing services for the early diagnosis and preventive treatment of disease. Some of these things are related to public health. But our concern is education. Public health education, how do we bring into our fold, into the departments of education, into the curriculum of our education? We can also do public health education. How to do it? How we can talk about public health policies? How can we, raise consciousness of our students to understand the complexities and politics of health? This is my concern today. Next slide. And public health also talks about the development of social machinery to ensure everyone is standard of living adequate for maintenance of health. Friends, you all know today, we are in the neoliberal era, market era, where the public is becoming private. You see the public institutions, public hospitals everywhere across India, nowhere there is adequate infrastructure. There is no infrastructure, no adequate number of doctors, hospitals, nurses, what not. Minimum things are not available in these public institutions. Because public is becoming private and private is making its own profits, we all know the status of private hospitals today, where they are, what kind of profit they are making. Every day we hear in media, we read in newspapers, the kind of violence they do on public. Friends, we need to be concerned about these things. It is very painful to all of us when we hear the stories of people who are suffering, whose families are suffering. Friends, as a citizen of this country, teacher education institution should start thinking about health and the rights of health of people. How can we protect their fundamental rights, health rights? Health right as a human right, how can we conceptualize it? Friends, for this, we need to become activists, not just routine things we do in the department. That's not enough. I'm not saying that we should not do. We have to do. We have to learn disciplines of knowledge. Why we should learn disciplines of knowledge? To go beyond the disciplines of knowledge and do something good for people. That should be our concern. That kind of citizenship education should be inbuilt into all the programs and courses of teacher education. Next slide, sir. Friends, if you look at the medical services and clinical services, they think about diseases and injuries, how to protect, how to cure.